We're here with Dr. Nathan Newman, innovator of the stem cell lift and one of the leading doctors in the country and the world who's developing new uses and new techniques for taking advantage of the miracle stem cell. Dr. Newman, how are you doing?
Great, thank you.
Tell us a little bit about your background in stem cell innovation. How long have you been working with stem cells?
I innovated the stem cell lift procedure about 12 years ago, and since then we've made many modifications and advances as we learned about stem cells more and as our technology improved.
And how many stem cell lifts, which is a very popular procedure, how many have you performed in the last 12 years?
Probably over 1,000 procedures.
Dr. Newman, the reason we're really talking today is to get some information about a recent report of a doctor who used stem cells in a procedure and had a pretty unpleasant outcome. Can you tell us a little bit, explain what he did, and then how that differs from what you do?
The report of the case where the doctor used calcium hydroxyapatite, which is Radius, to use with the stem cells that he got, was that the patient developed bone fragments because of the calcium stimulated the stem cells to create bone. What I do differently with the stem cell lift is I don't use any artificial fillers. I use your own natural body fat, and the fat is very good in directing the stem cells to create normal, healthy tissue so that we don't end up having these complications. Stem cells are very smart. They are made to repair and regenerate tissues, and they are going to do it according to their surroundings. So whatever surrounding they're in, that's how it guides the stem cells to do their task. If you put it next to a filler that is made out of calcium, it's going to make bone.
So what happened with this situation is she got a facelift, and the doctor also used stem cells, and he also used a filler that contained calcium, correct?
Yes. The filler that they used has calcium in it, which is the same thing in the bone, which the stem cells will get in the signal from the calcium to make bone, and that's what happened in this situation.
Okay, now you said that you thought it was odd that they employed stem cells, facelift, and filler in the same procedure. Why is that odd?
Well, if they got the stem cells from fat, the most obvious thing to use would be your own natural fat, where it would guide the stem cells to make tissue and not bone. And the fat is much more likely to last longer and to look more natural when you graft it into the face than any other filler that you would use.
We were talking earlier, Dr. Newman, and I asked about your background in stem cell innovation, and you said you were probably one of the first doctors in the country to employ stem cell technology for rejuvenation, and one of the first in the world, correct?
Yes.
Now, a lot of people are starting to use stem cells. How does one find a doctor who knows what he's doing with stem cells and who can understand the danger of using, for example, stem cells right next to calcium?
It's a very hard question to answer because we don't really know someone until we refer to them or we get...
Where can people go to get more information about your stem cell innovations, your studies, and what you've been able to do successfully with stem cell use?
They can go to my website, nathannewmanmd.com, or the stem cell lift face site, which is linked to my website, to learn more about the procedure and to see before and afters.
Personally, I'm fascinated with what you've been able to do with stem cells. I'm fascinated with the joint repair you've been able to do, with the relief you've been able to give people from pain. You've done facial reconstructions with stem cell use, and I have benefited from your rejuvenation techniques myself. So I'm fascinated with what you've been able to do with stem cells. I would like you to tell us the range of applications that you've employed.
My experience with the stem cell lift has ranged from reconstructive surgery post-cancer patients, or for cosmetic surgery, for facelifts or other body parts that we needed to augment. From there, we've gone into the joints, muscles, and tendons, and I work with a team of doctors that help us treat these patients very successfully. I've also had patients who've had autoimmune skin diseases who've approached me, and we've treated them very successfully, especially for a disease called lichen sclerosus, which is a disease that attacks the female and male genitalia. And till now we have had no other treatment for it that was very successful, and the stem cell lift shows very promising for this disease.
I would really like to reiterate and get your input. How can a person be as close as possible to certain that they're going to get a great cosmetic surgeon or a doctor of any kind? You said it's very difficult to do.
It's difficult to find a good doctor, and the best way to find the right doctor for you is to get referrals, to make sure that the doctor you're going to is a specialist in that treatment, not just in that field, but especially in that treatment that you're seeking.
I guess we want to refer people to your page. One of the things I love about your page is that you not only have testimonials, you not only have before and after pictures and descriptions of procedures, but you also have articles that you've published.
I believe in educating the patient. If we have an educated person that knows what they are seeking and knows that this is the answer for them, then we know that we're going to have a more likelihood of succeeding in achieving that result for that patient.
Well, thank you for talking with us, Dr. Newman, and I really hope that people go visit your page, Nathan Newman MD, and the other one is Stem
Cell Lift.
Stem Cell Lift, but it's dashes between stem-cell-lift.com, right?
Yes.
Okay, visit Dr. Newman's page, get some information before you go out there and try to find a solution to your aging or your pain problem. But my personal advice, and I sign my name to it, is go see Dr. Newman.
Thank you.